We all make choices about alcohol. Kids make choices whether to drink or not.
Bye, Dad.
Bye-bye.
Remember, I'm going to Alex's party tonight and sleeping over.
You have fun. Hey, remind me about that party again?
And adults make choices whether to talk about it. That's true of parents and every other trusted adult in a kid's life. Kids want to know our expectations, and they want honest answers in everyday conversations. So talk with your kids and help lead them on a positive path. Because when you talk, they hear you.
Would you like to work closer to home, save money on gas, and be rewarded for your hard work and attendance? Then Belicio Foods is looking for you. That's right, Belicio Foods is now hiring for multiple positions and shifts with great employee benefits, an on-site health clinic, competitive wages, and advancement opportunities. Belicio Foods is a company that truly values their employees. Apply online at beliciofoods.com/careers.
I had all the other employees at the Jackson County Health
quick
Department.
thing, my bad. Apparently the audio wasn't up there.
Oh, okay.
Sorry.
Oh, that's all right. Okay, well, we'll start over. No
Sure,
problem.
yeah.
Okay, well, welcome everybody to the morning show. And Dylan, you got all the buttons pushed right now.
Yep.
Okay, Dylan's
right.
good now. Okay. Well, see, this is what happens when he gets a few days off work.
Yeah.
You know, he forgets to push buttons. So,
We all.
all right. So we have some girls here with us. So let's start over and introduce ourselves.
So I'm Debbie, and I'm a community health worker for the Gallia County.
Okay.
I know I should have just said Gallia County, not
For
the Gallia
the
County.
Gallia County.
Yeah.
Is that like the Ohio State?
Yes.
Okay. All right. So we have Debbie.
And my name's Sasha Johnson. I'm the Director of Community Health for the Jackson County Health Department. I supervise the community health workers for our SEARCH program.
Uh-huh.
SEARCH stands for Southeastern Appalachian Regional Community Health. And that program covers 11 southeastern Ohio counties. And I could name them all for you, but I'm not going to bore you. So.
Okay. And it's the longest name in history, but that's okay. Search is much easier.
Yes, it is much easier. Yeah, and that program was basically a collaboration between the health department here in Jackson and
Okay.
Ohio University.
Okay, very good. So Debbie, what is your affiliation? As you said, you're from Gallia County.
Yeah. So as Sasha said, we do cover 11 southeastern Appalachian counties,
Okay.
and each of the counties has at least one community health worker.
So you're the Gallia County one. Okay,
Correct.
now we're making
Yes.
sense
Yep.
here. So okay, I gotcha. And then you kind of oversee the whole thing out of the Jackson County Health Department office.
Yep.
Okay, very, very good. All right, so Southeast Appalachian Regional Community Health of Ohio. So what are we doing? What are we focusing on?
So our program is funded by the CDC. It's called COVID-19 Response and Resilient Communities. That's the grant name. And our goal is to build resiliency in our communities against things like COVID-19 or any future,
God forbid.
Yeah. So we're basically just trying to support our communities and help them find the resources that they need. We have 3 target populations. Those are people with chronic illnesses, people with substance use disorder, and older Americans.
Okay. And then your focus is obviously on the counties in which, in Appalachia, in
Yes.
southeastern Ohio. Very, very good. So, what does a community health care worker do?
Well, there is a very technical definition, but
In terms that we can understand.
My definition is
Yes.
we work with clients to help them identify the needs and then help them or connect them with the resources in the community to support them.
Okay, so I always like to say, and even when we have our friends in from Holzer or whatever, it's like you're kind of like the concierge that helps direct people in the right direction, gets them where they need to go.
Yep.
Correct.
That makes
Yeah.
total sense.
Yeah.
So you could, you mentioned 3 groups of folks. People could fit within either
Multiple,
all of those
yes.
groups or none of those, one of
Yeah.
those groups or 2. So that would be a little bit challenging as well.
Yeah, it's definitely a very big, category
It's
of
broad.
people.
Yeah.
And we wanted it that way. We want to help as many people as we can. And according to many of the community health assessments in these counties, those are the groups of people that need the most help.
Okay.
So that's kind of where that came from. And a community health worker, the most important thing about a community health worker is that they belong to the community that they're serving. So this is someone
Sure.
that lives where you live. They experience life the way you experience it. So they're more
Because that could
able-
be challenging for someone from the big city to understand.
right. Yeah.
Absolutely. Yeah.
So we try to make sure that, we're very involved. Debbie's very involved in Gallia County activities. All of our community health workers are involved in their communities. They're networking. They're doing all the educational events and community events to make sure that they're seen and
Sure.
a part of their community.
And the more that you're seen out and about, people can have that personal contact with you and like get to know you and trust you.
Right.
Because I can see where, if you're battling any of the things that you mentioned, not battling, I guess is a bad word, but especially substance abuse or something like that, you're going to have to trust the person that you go to to talk to. Make sure that they can, I would think that you can trust them, that they aren't going to, turn you in or, say, and judge and all of that stuff.
So that's probably our main focus is to
Cool.
build trust in our communities. A lot of people are intimidated by healthcare workers
Yes.
or public health in general, so we want to kind of reduce the stigma of all those populations.
That makes total sense. And so all of this kind of maybe was thrust forward from maybe the COVID-19.
Yeah, that's where our funding came from, but that's not our
Sure.
sole purpose. We've, I don't know, some of the other CDC programs that are doing this really have a large focus on COVID. And we wanted to kind of, get away from that because there's so many other things impacting our area that do make COVID worse, but we want to address those root causes.
Okay.
If you are using drugs or alcohol and you have a substance use disorder and you get COVID, it's going to be a lot worse for you than it would be for someone who's generally healthy.
Right.
So that's the idea behind it, is that we're kind of addressing those primary health concerns.
Makes total sense. All right, love that. Okay, so let's get in a little bit to the health concerns that you all are addressing because there's quite a bit.
Yeah, Debbie is really tackled some of our falls prevention programs. We do a lot of evidence-based training. So we train our community health workers to do like a variety of activities that are evidence-based. So I'll let Debbie talk about those.
Yeah, great.
So I am certified along with other community health workers in 2 programs. The first, fall prevention programs. The first that I got certified in is Stepping On. And a colleague and I have held sessions in Pike County and Ross County.
Okay.
And Stepping On has been proven to reduce the risk of falling by 31%.
Really?
Mm-hmm.
And you mentioned our older generation, and how many people have you heard that they were perfectly fine, they fell, they broke a hip or something, and then that was it?
Yeah.
They never come back from
Health
it.
deteriorates
Yeah.
a lot from a fall. So
Okay, so fall prevention. Let's talk about that. That's exciting.
Yeah. The other
And you said how much percentage that you?
for stepping on, it's reduces the risk of fall by 31%.
Wow.
And that program has both strength and balance exercises. So we find that older adults that are very active, I walk every day or I do silver sneakers, I don't need fall prevention. But I think the addition of balance exercises, which isn't something we normally do,
Correct.
is very beneficial to people.
Okay. Because you exercise your balance the same as you do, like your muscles and whatever.
Right.
It that makes total sense. The more you practice, the better you'll be.
Exactly.
Yeah.
Yeah. And it
Sorry, go ahead.
it just helps people gain confidence.
Yeah.
We have found that some people become more active. They aren't as isolated in their homes.
Maybe they feel
And-
more comfortable.
Exactly. Yep.
Yeah. A little
Yeah.
bit more confidence. What so are these classes that you all have that you offer? Okay. All right.
There are 7 sessions. And
Okay.
after those sessions, and for stepping on, we have 6 different guest experts that come in and talk about their specific area. So we have either an occupational therapist or physical therapist comes 3 times, and they introduce the exercises and help modify them to the needs. Some people need to advance the exercises. Some of them can't quite do them at the beginning, so
Sure.
they modify it so everyone has access to the exercises.
Gotcha.
We also have a pharmacist come in to talk about medication. We have an eye specialist come in to talk about eyesight, and those are the ones I remember.
Okay, no, that's really good because all of that would affect your balance. Okay.
We also have another program called A Matter of Balance, and it also is a fall prevention program. And I have some statistics from the National Council on Aging, if you would like.
We would love that. Yeah.
All right. So A Matter of Balance decreases the total annual medical costs by $938. It reduces hospitalization costs by $517. A Matter of Balance reduces facility costs by $237 and reduces home health costs by $181 per participant.
I don't know. You might want to get James on that one.
Was that
see
a
if you can run him
lot?
down. No, we can keep going. It said the camera is a little hot, so we'll just keep on.
Okay.
We'll keep on trucking if that's
All right.
okay with you.
It's fine.
Yeah.
And we have taught A Matter of Balance in Bainbridge at the Bainbridge Senior Center, and we have some upcoming Matter of Balance classes.
Okay.
Gotta find my notes on that one. We are going to.
Because I assume you have these classes in different locations, right?
Yes, we
Okay.
do. We find that senior citizen centers are often willing to host be a location.
Now that makes sense,
It
doesn't
doesn't
it? They're there anyway.
Yeah.
Let's party.
Exactly.
Yeah.
So we have sessions at Bristol Village in Waverly that are starting in December.
Okay.
And we have sessions at Bainbridge that will start in March of 2023.
Okay. Very good. Now, how would people find out about these classes?
At Bainbridge, they put out flyers, and we have a contact, and if we don't have a lot of attendance, will share with us some phone numbers, and we can call people directly in case they have questions about the program and encourage them to join us.
Okay.
We also we're trying to get sessions for Jackson, and we offered a session like a dip your toes in. This is
Yeah,
what we
like a little
do.
preview session.
Yeah.
Love that. Yeah.
And Waverly, we are at Bristol Village, and we're fortunate that they publish it and put it on their, like they have a TV channel in-house.
Oh, okay,
so that
great.
their residents can find out about it that way as well.
Ooh, that's so smart.
And this is something we would offer to any of our 11 counties. So if there are, nursing homes or senior centers or YMCAs that would want to hold classes like this, they could just contact us and we could set up classes.
Oh, that's so nice.
Yep. And we work a lot with the AAA 7 in our
Yes.
area.
Okay, what's
Um,
that?
It is the Area Agency on Aging.
Okay, okay.
And District 7, which encompasses Jackson and most of
Sure.
our other counties. So they help a lot with a matter of balance
Correct.
classes.
Yeah. They did our the master trainer trained all of us, and
okay.
They trained the trainer.
They trained the trainer.
Train the trainer. I love that.
And I was lucky enough to actually teach a class with the master trainer because they needed an extra person. So, yeah.
I'll
think that was
volunteer to learn from the best, right?
Yeah.
Yeah, after I volunteered, I had to think about that.
It's a little bit
Yeah, what did I just
intimidating. No, that's so good. If you learn from the best, that's fantastic.
Yeah.
Very, very good. Okay, so the fall prevention programs, that seems definitely like a major major asset of something that you all are doing. I noticed that there was some eye screening that was mentioned here. I thought that was really cool because I think that's like one of those things that people don't want to pay for.
Yeah.
And also, here's the deal. Like you don't know you can't see until you can see,
Right.
which is so bizarre.
So yeah, we
Yeah.
work with Prevent Blindness Ohio to do those eye screenings, and they've been wonderful training our community health workers to screen other individuals for their vision, and we also have access to their services as far as like paying for exams and for eyeglasses, and that even applies to someone who may be on Medicare and has met their limit for eyeglasses for the year.
Okay.
And then say they broke their glasses. They could come to us.
Which happens all the time.
Yeah. But they could come to us and still get another pair. So that's pretty cool.
That is very, very cool. And here's the thing, man, again, if you can't see properly, it affects everything in your
Yeah,
life.
Every aspect of your
Every
life.
aspect. Yeah. Driving, all of that.
Mhm.
So cool. That's really neat. Okay. And how does somebody get signed up through that?
They would just need to contact one of their local community health worker. Our flyers advertise like personal numbers for each of our community health
Oh,
workers.
okay.
And they could also just call the Jackson County Health Department and get linked up with their community health worker.
Okay. So you just go to your local person and again, you'll be the concierge
Yep.
that sends them in the
Yes.
right direction. Okay. Makes total sense. What are some of the other things that you all are working on? I mean, there's like
We're
this
doing so
huge
much.
list.
Yeah.
I mean, it's basically everything.
Yeah, any need that you
Is
might
there
have.
anything you don't do? Maybe we should discuss that. But no, I'm just kidding.
Well, we do a lot of screenings. We talked about the
Yeah.
eye screenings already. We have diabetes screening,
Oh, okay.
and we have a couple of people certified to do HIV testing.
Okay.
And
Is HIV still a thing? Like, you heard about it years ago, but you haven't heard about it much recently.
It is. It's kind of in our most southeastern point of Ohio. I think we struggle with it there the most.
Is it kind of drug related, I would have to think?
It can be drug
Okay, yeah.
related, yeah.
Okay.
We do, all of our community health workers are lay distributors for naloxone as well. So if you've heard of Project On, they distribute Narcan. Our community health workers have access to that program too through Harm Reduction Ohio.
Okay, and could you just go ahead and explain that for those of us that are ignorant and don't know what you're
Yeah.
talking about?
So naloxone is an opioid reversal drug. It blocks opioid receptors in the brain from recognizing that there's an opioid present in the bloodstream, and it prevents overdoses. So it's a temporary solution to an overdose.
Okay.
But it's like a first response. To if you witness one, anyone can carry naloxone. It's a safe prescription drug. If you're not overdosing, it's not going to hurt you.
Okay.
So it's very safe for everyone to carry. They can't cause anyone any harm by using it if it's not necessary, but it will prevent someone from dying in an overdose situation.
Okay, got you. Now, how is that administered? Because I've heard of different
There are different ways,
ways.
For it to be administered. The most common is nasally. It's like a nasal spray. And so you would just
Oh.
right up the nostril and, it's like Flonase. And it
Okay.
can also be administered intramuscularly.
Muscularly. We got it.
Like in the thigh or, in the arm or whatever. And I think there's another way too. You can do it like intravenously. The hospital will do it that way, but that's not
Okay.
right.
Yeah, anybody carrying that stuff around is probably not going to do that.
The
Up the
easiest
nose
one,
it
though.
goes.
Yeah,
Yeah.
up the nose.
So that is actually a thing where you can go to the health department and get
Yeah, so
this and carry it in your purse or whatever in case you happen to see somebody that.
Yep, all of our community health workers have it, and also the Jackson County Health Department has a great integrated naloxone program. So that's a grant offered through the Ohio Department of Health to many different organizations, but a lot of local health departments take advantage of it.
Okay.
And they receive money from the state to buy naloxone and also to fund the position of a coordinator. So we distribute it through our local health department. And you can get it mail order through our website, or you can just walk in and get it too.
Okay. Now, I have heard, I don't mean to focus on this, but these are a couple questions that I have. I have heard a few people say, I don't want to carry that stuff because I don't want to be liable for, hurting someone or not saving them or giving them something when they weren't overdosing and it was another situation. What do you say to that?
In Ohio, we have what's called a Good Samaritan law, which protects anyone that's administering first aid like that, including naloxone. So no matter what you do, if you're doing something that's
that you perceive trying to save someone.
right,
Okay.
then you're protected. Nothing can blow back on you. It's the same as if you were to administer CPR. If you get CPR certified and you administer CPR to someone, you can't, there's no negative repercussions if you broke their rib because you were administering a life.
You're doing the best you can, man.
Yeah, so that's the law that protects you. I would advise anyone to carry naloxone, and we even promote it to the older Americans that we see because a lot of them are on prescription drugs. And if you couple prescription opiates with dementia or Alzheimer's,
I see. Okay.
you could very easily overdose,
Sure.
And so it's really, really something that needs to be on hand for you if you're on any kind of narcotic.
And it seems so simple.
Yeah.
Why not?
Yeah.
But, and then you hear the other argument of, well, they're overdosing, so they deserve what they get situation. And I'm like, oh, come on,
Our
guys.
hope is that
We want to reduce the stigma.
I'm
Yeah.
sure that I
associated
just
with substance
struck
use disorder.
struck a string with you guys on that because I'm
No,
sure
we
you hear that
it.
a lot.
We hear it a lot.
Yeah.
And
Yeah.
it's our goal to just I save people's lives. We don't want anybody to die, and every time that you might administer naloxone, that could be the time that they wake up and say, "Wow, this is not okay," and hopefully reach out to someone like Debbie or myself or our other community health workers.
Yes. Like I've hit rock bottom.
to access those resources that we have available to them. So it's our duty as healthcare professionals, but it's also something that I think all of our community health workers have in their heart,
Sure.
so.
And that's good. I would hope so, because if not, then you're probably in the wrong
Yeah.
profession, right? It's the rest of us out here that you need to get to, right? Okay, so no, those were just a couple of questions I had about that, because I think that it scares people maybe to have that and feel as if they would be held liable
Yeah.
or something.
It's a scary situation. We've got a lot of work to do as far as, educating on all three of our target populations and
Yeah.
reducing the stigma of all of those things. I mean, every day I think we all experience ageism too. So that's another stigma that we're trying to fight against.
Yeah. Isn't that crazy?
Yeah.
You're too old.
Yeah. You're never too old. Age doesn't define your level of activity or the things that you can do or the fun that you can have. there's my spiel on that one.
No, I think that's fantastic. I love that.
Okay.
Yeah. Yeah, no, that's really good. All right. So what are some of the other I mean, there's like again, these ladies do everything. So
A couple more of the evidence-based programs that many of our CHWs, community health workers, are
Okay.
certified for. A lot of suicide prevention
Oh.
programs. The one most of us are familiar with is called QPR, which is question, persuade, and refer,
Okay.
which essentially, if you think that somebody may be considering suicide, it is okay to ask, are you considering suicide? Are you considering ending your life? And do you have a plan? It's not going to put an idea in somebody's head to
Okay.
choose to end their life. But if people say yes, then we know to refer them to get help, persuade them to get help, and then can refer them to the appropriate type of help.
I gotcha.
Yeah.
And that's more prevalent, I think, than what people think. And
Mm-hmm.
the suicide rates, I think COVID certainly didn't help
No,
That
it
is
did
true.
not. It did not help
matters.
mental health in general. I think,
Yeah.
especially in our area where people are already more prone to mental health issues.
You know, and what group do you think was affected the most by that?
I would say that all of our target populations were, but especially isolated older adults. So those who are stuck in their home or maybe, have a chronic illness where they're in a wheelchair, they were not getting out. They were protecting
Sure.
themselves from getting sick, especially if you've already got an underlying health condition.
Right.
And so that cut people off from their families, from their friends, from even their healthcare providers. We moved to like doing virtual health visits,
You're right. And that's just not the same as having someone,
that social interaction.
Yeah.
even someone just putting a hand on your shoulder or
Right.
something. You
Yeah.
know, it's just really
We
sad.
all need
We need a
that.
hug,
Yeah.
you know? We do. We all need a hug occasionally. And I thought about that, and I think that's why it's so important. This is my soapbox to in Jackson we did support the senior levy, but that's all that some of these people have.
Yeah.
Mm-hmm.
So you need to make sure they're okay. Yeah, for sure.
We do have a lot of delay in getting access to mental health providers. So one of the programs that we also have is called Friendship Bench, which is kind of like light counseling. So if you feel like, oh my gosh, I just need to talk to somebody, it's literally a bench. You go and you talk to somebody who is
On a
trained.
park bench
Yep.
or
Oh, you're kidding. That's such a good idea.
yeah, very similar to like
Yes.
peer support.
Yes.
It gives community health workers an opportunity to like really connect to the person that they're, informally counseling, to share, stories of their lives or whatever. Really meeting people where they are.
That is
Yes.
wonderful. And you just think sometimes maybe somebody just needs to vent for a minute.
Right. Yeah. Oh, we all.
Right. And sometimes, and I feel like this too, like, especially like people that, even like parents that they're obviously having to be support for maybe their parents or their children and all of that. And it's like, who do I
turn to?
Who do I vent to?
Yes.
Situation. So that would be nice. Sometimes it's nice to have an unbiased bystander.
Yeah.
Right.
Yeah. Okay, so meeting on a bench. I love that. That's
Yep.
such a good idea. And that would be something that you would do or one of the
That would be our Athens County community health worker.
Okay. Very, very good. And Athens is beautiful, so you can go
Yes,
there
it
and
is.
hang out.
And many of us are also going for mental health first aider certification. And
Oh,
that's a
okay.
little bit different from the QPR in that it is a way to implement a strategy to first recognize signs of a mental health challenge and then being able to approach the person and having the confidence to talk to them. Maybe hearing, oh, there's nothing wrong, leave me alone, but still be willing to continue to push a little bit to help that person realize, oh,
Ooh.
I might need a little help. I might need to talk to someone and help get them the service they need.
Man, that's a
Yeah.
sticky situation, isn't it?
It is.
Yeah. We practice
It
a lot
is.
of like motivational interviewing
Mhm.
techniques and just trying to be as trustworthy as possible.
Yeah.
We don't want to like put anyone in a weird situation or make them feel bad about anything that's going on. So, words matter, and we're very careful about the words that we use and how we use them.
Very good. I love that. Keep going. She's got a list. I know.
She does have a list. I'm like trying to read it a little bit. So
It's a long list.
Some of the evidence-based programs that we are like on the waiting list for
Oh.
training, Tai Chi, which benefits the older adults in several categories.
Okay.
Mhm.
What is that? Like martial arts kind of thing, or
it's kind of like a low key martial
is that the
art.
one with the
And
where they do
yoga.
the like
Very slow.
yeah, slow
Yes.
movements? Okay, yeah, love that.
Which is why it's good for older adults.
Yeah.
And it also helps to decrease the risk of falling. It also leads to a healthier cardiovascular system,
Okay.
improved sleep, increased immunity. Oh, this is a good one, especially for older Americans. Chronic pain reduction,
Mhm.
helps treat diabetes, and of course, there's the social interaction aspect of
Of
it.
course.
It's just
Yeah.
fun.
Yeah.
Yeah.
So we
And
have
it's relaxing.
many people looking into that because
Okay.
it's being offered. And again, in our Athens area, as soon as we can secure an indoor facility, she's going to offer free yoga and meditation because she is
What?
certified.
She is a certified yoga instructor, our Athens
Mhm.
County community health worker. So
Oh, great.
that's great. And we're hoping that she can get some, evidence-based programming training so that she can help specifically with things like chronic illnesses or chronic pain,
Okay.
and also mental health. Yoga practices for all those things.
I was going to
Yeah.
say if there's one thing in the world that can help all of those ailments, it's yoga.
Yeah.
If you've never
Right.
done it, it is amazing. Yeah. You feel so good afterwards.
Mhm.
Yeah, absolutely.
So if you haven't been able to tell, we focus a lot on training. We train
No,
our
that's
community health workers
good
to do a
because
lot of things.
then you can trust that you can go to these ladies and be
Yeah.
like,
And if
help.
one of them doesn't know, this is a network. So,
Yes.
we've got 10 community health workers right now, up to like 14 is our max capacity of community health workers working in this region.
Okay.
But if your local community health worker doesn't provide a certain program that you're looking for or doesn't have the information that you're looking for, they can contact any of the other community health workers in our network really easily and get that information for you and even get them to you.
Okay.
So
Very good. And again, what's the easiest way to find that person?
we do have a Facebook page, Southeastern Appalachian Regional Community Health.
Okay.
And on there, you can contact that page. It'll go to me, and I can connect you with your local community health worker, depending on which county you live in. Or we have a flyer that's available on that Facebook page that has all of the phone numbers listed for each county. So you can
All right.
contact your community health worker directly.
That is awesome. So you guys are making it as easy as possible.
Trying to.
Love that. Love that. Okay. So where do you see some of the intertwining of the three categories in which you said?
Currently, right now, our Pike County community health worker is really involved in homeless outreach.
Okay.
So we see a lot of multiple of those categories in the homeless population. So
What? Go ahead.
they just might be experiencing all three even. It could
Sure.
be an older adult who's maybe a veteran who has a chronic illness, and is homeless and maybe has some substance use issues. That's very common, I think.
I think so, and I think that it's kind of like the chicken or the egg, and
Yeah.
the egg or the egg.
Which came first?
Yeah,
Yeah.
and I think what would you I know it's not an easy category to fit everything into, but what would you say as far as like is the main culprit of the homelessness at this point?
That's a tricky question.
Yeah.
There are myriad reasons why someone might be homeless. A big driver, I think, is mental health issues, including substance use disorder. And the homelessness and mental health issues seem to be really high in the veteran population.
100%. That was kind of where I was hoping you would go with that situation.
Sorry, it took me a minute.
No,
I got there.
So there's an area, we have a place in Columbus and there's an area close to it. And I noticed that there was a population of, homeless there. And so instead of getting mad about it or like, whatever, I started paying attention and I started realizing that I feel like most of the humans there's a mental health issue.
Yeah.
And I came home one day and I was telling my mom about it. I was like, they have nowhere to go. Like they're stuck in this, like, they don't fit anywhere. And it makes me so sad.
Yeah. And when you're already struggling with like knowing your own mind, it makes it that much more difficult. Someone who is completely healthy, who finds himself homeless, has the mental ability to find the resources that are out there to connect to someone.
Correct.
But if you're experiencing, some kind of depression or anxiety or PTSD,
100%.
especially PTSD, I think.
And you fell through the cracks somehow.
Yeah.
Then one starts the next and you get into the drug issues and then you become then the illness. Yes.
And, all those things. And then you are just so far removed from your own mind that it might be difficult to even trust somebody enough to reach out to them and say, hey,
Sure.
I don't want to be homeless anymore. So yeah, that's what we've got 2 community health workers right now in Pike County
Good.
that have done homeless outreach at least once a week for the past several weeks. And they have told me that in the past, 1 or 2 times that they've gone, they're getting recognized by name. People are saying hello to them, like, oh, I'm so glad to see you. And that's the beginnings of, I've made a connection with this person and now I can really help them. Now they trust me. I can say, hey, this is what you need to do and I'm going to help you. Mm-hmm. And they're going to trust you to do that. So.
And I love that because it's like, I don't think any of us wake up in the morning and decide to be homeless.
No.
So I don't understand why everybody is so nasty about it.
Yeah. Puts tears in your eyes a little bit.
It does. Absolutely. Because it's like nobody chooses this. And it's a lot of the times it's through no fault of their own that this is the situation in which they're in. So just have a little empathy, I guess, before you start judging. Is I guess another soapbox that I get on because
just a little empathy.
Yeah, the world needs a lot of empathy, but
if we can all start with a little bit,
Yep, just take that 5 seconds and think about what's happening before you start judging,
and be thankful for the things that you do have because just. Any of us could find ourselves in that situation, given the right circumstances.
Absolutely.
So it's almost Thanksgiving, so take a minute to be thankful for what you do have.
Love that.
And have a little empathy for the people who don't have what you have.
That's exactly right. And do-gooding is a good thing. So if you're feeling like do-gooding, do it. Do it year round, but do it especially right now. It's cold out there.
Yeah.
Okay. Didn't mean to get off on that tangent, but I wanted to, I don't know, in my opinion, make people aware that, most people don't decide to be homeless. Right. Like, I would think 100% of people aren't like, I think I'm going to go be homeless today. That sounds like a fantastic idea.
And given some time and support, most of the time, if you're helping them see a way out of it, they'll take it.
Yeah. Why wouldn't you?
Yeah. At first you might not. At first you might be scared too, involve yourself with maybe Metro Housing or some government agency, but finding a person you trust makes the biggest difference.
That's right. And that's where you guys come in. Well, that's very rewarding, I'm sure.
So that was Pike County. We also had in Scioto County, our CHW partnered with the local high school, the Honor Society, and they
Okay.
collected tents and camping equipment, sleeping bags for, you can't always get people to go for the
Yeah.
government housing, but at least, now they're protected from the elements.
Okay.
So,
That's a start.
yeah,
Yeah.
yeah,
reducing a little bit of
Mhm.
the
the hardship.
Yeah, and I feel like if there's nowhere for them to go, we need to at least make it the easiest way possible.
Yeah.
Right.
So, okay, very good. All right, keep on going, sister.
What do you got on here?
She's got all kinds
So
of
we
stuff.
have, I do have a lot of stuff.
I mean, like I'm looking at this, we haven't even touched half of the stuff that you guys do.
I know one of the questions is where do you find the CHWs? How do you get in touch with them?
Yes.
Some of the counties, people have been partnering with the food pantries, like will help pass out food, and
Okay.
we'll have one that helps, with the food situation, and then have another CHW with a table there that you can, you see us there
Yeah.
over and over again. We're going to be there the next week
Okay.
and the week after that. So that helps to build the trust so that then we can start talking with people, identifying their needs and getting them the help that they need. So we partner with food pantries. Sometimes we are able to set up at the library, just set up a table.
Oh,
It says,
great.
here's your CHW. And
Okay.
we do have, every month we have a disease of the month
Yeah.
that we
disease
talk
of-
about. So we are just promoting a specific, February is Heart Healthy Month.
Yes.
Okay.
December is flu.
Right.
So
That
get your
makes
flu
sense.
vaccine. Yeah.
I mean, look, let's talk about this flu for a minute
Yeah.
that everybody has. If you haven't gotten it yet, consider yourself fortunate. I
Yeah.
feel like. Yeah.
So of course we promote vaccines.
Yes. Childhood vaccines,
Makes-
flu vaccines, pneumonia vaccines for the older adult population.
COVID vaccines.
Yes, COVID vaccines.
Okay.
All of those available at your local health department.
Hey, can I ask you one question that's kind of off? It's on the subject, but off the subject.
Yeah.
There is a new COVID vaccine booster, and while you guys are here, and you guys would probably be good folks to talk about that. You don't hear anything about it. It's really annoying to me.
Yeah. I mean, we hear about it all the time.
We do.
Well, I'm sure, but before it was all over the news. You get your vaccine, get your booster. Do this, do that. They're telling you what to do, and now all of a sudden there's this new booster out that kind of covers a lot of these strains of COVID, and nobody knows about it.
So there was a big shift from COVID being a very new type of illness. Coronaviruses aren't new, but this strain of coronavirus was
It kind of
was
took
brand
the
new.
cake. Yeah.
Yeah. So, and we weren't sure how it was going to act. So there was a lot of fear-based reaction, I think. People
Sure.
in the public health community were afraid that this was really going to take us all out.
I mean, or is this going to wipe out our population?
Yeah, we didn't know. So that was kind of that push at the beginning. And we moved from this being such a new virus to it basically being what's called endemic. It's an endemic virus now, which means that you're not going to be able to trace it. So there was all this contact tracing going on. We were trying to find where the virus originated and cut it off. That's why the contact tracing
Okay.
happened.
Yeah, that didn't work.
And it didn't work. So now
At all.
So the viruses that we know about, flu and a cold, are considered endemic viruses, which means you can't really stop the spread of it.
So
It's
what
just-
goes from pandemic to endemic?
It's the number. Please don't quote me because I'm not a nurse and I'm not an epidemiologist.
We'll get Mikey in here to talk about that
Mikey
stuff.
is the one to talk about this. So, but from what I understand, and it just, it's the number of people who've been infected by
Okay.
it. So, it's just spread so far and wide that we're not going to be able to cut it off anywhere. It's not going away. So we've moved to the vaccine prevention side of it.
So
And-
COVID has turned into the flu. Another thing like a flu where we get a booster and you hope that it helps.
It's going to be similar to that, not that
It's not
COVID
going
and flu
away.
are the similar viruses because they're not, but
We're
I
not
think-
curing it.
Eventually, we would start treating it more like the flu.
Okay.
In that you would get some kind of regular vaccine, like we're doing with the boosters. The new booster is a bivalent
Yeah.
booster.
Back to that.
Yeah. So which that means it has 2 strains of the COVID in it. So vaccines are, just 1 strain, or they're bivalent with 2, or trivalent with 3. And we do that with the flu vaccine also. Generally, your flu vaccine covers 3 strains of flu, I think. It's a trivalent vaccine.
Oh, okay.
And there's an option for older adults above 65, I think, to get a quadrivalent flu vaccine also, which covers 4 strains.
Okay.
And basically every year, the best and brightest epidemiologists and scientists figure out what strains of flu they think will be most active.
Yep. Sometimes they get it, sometimes they don't.
Sometimes they get it, sometimes they don't.
Yeah. So back to the bivalent, the COVID booster, I guess you would call it at this point. Who should get that? Oh, I'm really putting you on the spot, but who's eligible for that, I guess?
I'm not sure what the current recommendations are for the bivalent vaccine. I think that you are able to get it as long as you haven't had COVID in the last 3 months.
Okay.
And it has to have been at least 5 months since your last booster.
Okay. But you don't start with that one, right? Like
No,
if you
you don't
haven't
start with
had
that one.
any, you need to tell somebody and say, "Hey,
you would have
I'm
the
just
first
starting
series
here."
first. Yeah.
Yeah. Okay. All right.
Yep.
Because again, I'm not meaning to put you on the spot. I'm just asking because it's so confusing for all of us out here. James and I have had this discussion like for a month. Like, do we go get it? Do we not? Are we eligible? Like, are we supposed to go get it? Like,
Yeah.
where do we get it?
I would go ahead and go get it if you can. And the best thing to do is to call your local health department
Okay.
and ask them. You can contact anybody pretty much in their nursing departments. Most of the front staff would be able to answer questions like that as far as, who's eligible.
Okay.
So yeah, contact your health department. Don't take my word.
Yeah. No, and again, I didn't mean to put you on the spot.
That's okay. I'm doing the best I can to try to give you accurate answers. But definitely contact your local health department.
Okay, very good. And that's the thing, ask your doctor, ask your primary care physician,
Ask your community health workers.
ask your community health workers.
They will find the information for you.
Yeah, and if you don't know, you'll find out.
Yes. Correct.
And you have the access to do that.
Yep.
Okay, so I took that off on a tangent, but I wanted to make people aware that exists.
Yeah, it's still an issue. It's going to be an issue. We just have to, keep moving on. Keep washing our hands, keep covering our mouths when we sneeze and cough. And
Yeah, keep doing the things that we were supposed to do from the get-go that we never
we're
did.
supposed to do. Yes. It's like RSV. Like RSV is going around right now, I feel like.
Huge.
I'm like, people just wash your hands and cover your mouths and keep your babies home.
Yeah, and so here's another soapbox I'm going to get on for a moment. This is my opinion, not anyone else's. Even if babies are at a Thanksgiving, get together or whatever, just kind of, I don't know, keep your hands off of them and keep your mouth off of them. We all want to hug babies and we all want to hold them and kiss on them and love them so much, but maybe this is not the best time to be doing that.
Not the time to be doing it. I don't know if there is a time to be doing that. I wouldn't touch Debbie without her permission.
Right.
So I'm not going to grab somebody's baby either. As cute as they are, as lovable, my niece or nephew,
I know.
protect them by not touching them.
Yeah.
Or kissing them.
Exactly.
Yeah.
So just kind of keep that in mind if you're at a big family gathering that just a little distance is still not a bad thing.
Definitely not a bad thing.
That way we can all continue to have gatherings.
Yes.
Which is great. Okay. All right. Back on your subject again. As we digressed a lot.
Well, we've talked a little bit about this, but many of us do the harm reduction programs in collaboration with our local health departments. And what harm reduction means is safe syringe programs, where I'm very familiar with Gallia County. If someone has needles, they can bring them in and they're deposited in a
Safe space.
safe space, and they can we can give them up to 30 clean syringes, new syringes to use.
Okay. So here's another one.
Okay.
What do you say to the people that are out there saying, well, they're just promoting drug use that way, giving people needles? Are you kidding me?
We do hear
We
that
do
a lot.
hear that, yeah.
Do you want me to take this
You're
one?
best at
I'll
that,
field
yeah.
this one? Okay. So, yeah, we hear that a lot. And we don't, I will be upfront, we don't promote drug use. That's what we're out here doing, is trying to help people who already are using drugs to reduce the harm that they're doing to themselves. So we do this, like Debbie said, through syringe exchange programs, through naloxone distribution, through a lot of other different ways we reduce harm. But the syringe exchange programs specifically, I think Gallia County is a 1-to-1 exchange. Jackson County's is a 1-to-1 exchange. If you bring 5 needles in, you only get 5 clean ones to walk out with. And we do this because it reduces healthcare costs. And it reduces healthcare costs by lowering rates of disease. So,
And why would that be?
drug users tend to share needles.
Yes.
And because there just they don't have access to clean ones, else they would use clean ones. But the short supply that they might have, they're sharing them, and they're contracting bloodborne illnesses such as Hep C or HIV.
Yes.
So providing clean needles takes dirty needles off the street. In almost all studies, it has shown a reduction in syringes laying on the ground. Some studies have even shown that people who use drugs and who exchange needles will pick up needles that they find on the ground and take them into the...
Makes sense here. I need one. Yeah.
Yeah. So, and it doesn't put any more syringes on the street because of the 1-to-1 exchange.
Yeah.
And like Debbie said, they only provide up to 30. So if you bring in 50, we're taking all 50, but you only get 30 back.
Okay.
So it even in some cases reduces the number of syringes that are out in the open. And it also provides people with the thing that we've been talking about this whole time, that sense of trust. I can go in here. These people aren't going to tattle on me. They care about me. In Jackson County, they're receiving way more services than just the syringe part of it.
Okay.
They see a nurse practitioner, Kim Hughes. She's our nurse practitioner at the health department, so they can see her for anything, really.
Yep.
They get to talk to, our nurses. We have treatment providers available there to talk to them. So it's really our way of building trust in that community and saying we genuinely want to help you get out of this place that you're in. So if that means that we have to, give them some clean syringes, we're going to do that.
Correct.
Because
are y'all getting this? There's a method to the madness.
There's a method to the madness. It's
Yeah.
not just, we're not just out here, putting syringes in the hands of people who never use drugs.
Right.
We're
You're not
trying-
encouraging it. Like,
No,
here,
no,
take
no.
this and try it.
We
Like,
would never.
No,
So-
no, not at all.
We're just, we're just trying to reduce some harm and hopefully through reducing harm in that whole population, we're getting, if you get one individual to go into treatment after you've talked to them, that's a win. I mean,
Yep.
that's huge. So that's what we're trying to do.
Okay, good for you. And I guess that's why I've heard that so much on the street. Like, I cannot believe the health department gives people needles.
Yeah.
I'm like, well, y'all aren't getting the full, you aren't understanding the big picture here.
Yeah.
The big picture is we're trying to prevent, they're going to do it anyway, and we're going to trying to prevent.
You should, I don't have the numbers with me, but I would encourage people to look into how much it costs to treat someone with hepatitis C or HIV. And we know that most people who are using drugs are either on Medicaid or they don't have insurance at all. So these are costs that taxpayers are already paying. We're paying for the repercussions of those actions through treatments for Hep C that are charitable, and through Medicaid and Medicare. So I don't know. It just keeping one person from getting Hep
Yep.
C saves like, I don't know, $500,000 in taxpayer money or something like
Plus,
that.
they're not spreading it to somebody
Plus,
else.
they're not spreading
and
it to
here we
somebody
go.
else, yeah.
Like it's an ongoing thing.
Yeah. Lots of savings as far as healthcare costs go. Lots of savings as far as disease goes.
Yeah.
I mean, if someone gets out of, drug use, it's hard to re-enter society maybe if you've got one of those chronic conditions or
Correct.
so if we can prevent it from ever happening, and then they do access the resources that are provided to them, and they live a healthy life after that. So that's the goal, is that everyone lives a pretty healthy life, generally healthy life, where we can all be happy.
Can't we all just get along
Yeah,
and love
right.
each other? Yeah, and be as healthy as we possibly
Yeah.
can. There's enough stuff out there to get you. You don't need to do it to yourself.
Right. Yeah.
Right. Okay. Well, very good. What else? I know you've got more. Look at her go.
You want to talk about our upcoming events?
Debbie, we're going to say you're full of it.
Lovely.
Yes. In all the right ways.
Yes. Well, our upcoming events, February is some of our counties are collaborating to hold an adult prom.
Yeah.
Fun.
So that'll be, I think, Athens, Hawking area.
Okay.
They're going to be doing an adult prom, maybe include Vinton.
Right.
So that will be super fun. It's Heart Health Month, so we're trying to promote healthy hearts.
Okay.
And, we thought what better way than to have, a prom. Everybody can dance.
We can
and
dance.
Get a little exercise. And
Boogie down.
Yeah.
So many of our counties are doing other events too. Some of them are just doing heart healthy walks, things like that.
Yeah.
So,
I think there's going to be a mini health fair in Scioto County.
Okay.
so definitely look for all that information. It'll be upcoming. Planning is still happening in all of our
Yes. Yeah.
counties. So,
Yeah.
but that'll be a fun February.
That will be.
Yeah.
Absolutely. And here's the thing. You can participate in the turkey trot this coming Thursday morning at the YMCA before you go and eat too much.
There you go.
It's great. It's win-win.
All the things.
Well, very good. So is there anything else? We have like 2 minutes left. Is there anything else that you girls would like to tell our viewers?
We do have a couple open positions right now.
What?
Yeah. So
So if you're looking for a job,
if you're looking for a job, we are hiring for a community health worker in Perry County, in Meigs County, in Gallia County, and Lawrence County.
okay.
So all of those.
And what would be the criteria for that?
You have to have a high school diploma, and then we everybody that we hire goes through a community health worker training process. So that's provided through Ohio University, and it's on our time, so you get paid for the education portion. And then following that, it's I think 100 hours of classroom learning that's usually done virtually, and then 130 hours of field experience, which you would do on the job. And then you apply to the Ohio State Board of Nursing to become certified as a community health worker.
But you don't have to be a nurse per se ahead
No.
of time, like a
Nope,
registered
high school
nurse or
diploma,
anything.
that's all you need.
Oh, okay. Because you're getting trained on the job.
Yep.
And that's the whole point.
Yep.
Like, get trained on the job to do what the job is that you're supposed to be doing.
Yeah, I think that was a
Great.
big goal of the CDC when they released this funding, was they just wanted to, in general, train more community health workers to be available
Love that.
everywhere. So we focus a lot on the training. We focus a lot on our clients too and community outreach, but we really want to train the individuals that we hire for this position. It's a short-term grant. It only runs through 2024. So we really want to give everybody that we hire some knowledge and some experience and some training to carry with them,
Okay.
when the grant's over.
Okay. Very good. Well, girls, thank you so much for spending your morning with us. This has been so
Thank you.
fun. And come on, cheers from the Peanut Gallery. Woo! Yay! They did it.
Thank you for having me.
Oh no, thank you so much. It's been our pleasure, and we hope that y'all have a happy and healthy and safe Thanksgiving.
Thank you.
Good, yeah.
Thank you. You too.
All right, so tomorrow we are going to have a few guests from the drama club. Okay, so we're going to be talking with them. This should be fun. It'll be very dramatic. And of course, then we'll be out of here on Thursday. So until then, have a great day. And thank you so much for tuning in. We'll see you right back here tomorrow with some drama. Bye-bye.
This just in.
The Telegram News has a new website.
TheTelegramNews.com.
Same dedicated coverage.
Same trustworthy news with a brand new look.
Covering Jackson and Benton counties and surrounding areas.
Locally owned and operated, TheTelegramNews.com has its finger on the pulse of the community.
Stay up to date on local events, high school sports, and breaking news.
TheTelegramNews.com.
Subscribe today at TheTelegramNews.com.
Check it out.